Welcome to CaliforniaCare again. Today we are going to talk a little bit about local anesthesia. The first aspect of it is the local anesthetic syringe that we normally use. I do recommend that we use a medium length needle instead of long or extra long. The key is to put the needle on by screwing it on, and of course then you load the carpio. Some of the syringes are side loaded and some are open on one side, and you pull the plunger back. It allows for the carpio to go in. But nonetheless, whatever you do, make sure that as you uncap the needle, you uncap it by one hand. As you uncap it with one hand, you drop the needle cap. The trouble with uncapping with both hands is that you'll have a reflex in which the hand comes back and you might stab yourself. And you go ahead and go give the injection. Normally this length, which is about an inch, which is 2.5 centimeter, 25 millimeter long, is more than enough to give majority of the injections. The only time we need extra long needle is when we are giving Gaugates or echinosi. Vazirastani is also another name that you give right close to the condyle when the patient is unable to open the mouth. The other syringe that I would like to talk about, and let's come back to this. When you're recapping, please don't recap with both hands, because again you can end up poking yourself. The best way is leave the cap down there and scoop up the needle with one hand, and then you can use the other hand to tighten the cap, and you put the syringe away. Anytime you put the syringe away, make sure it's pointing away from you. So just in case by mistake the needle has undone itself, the cap has come on off, you don't end up poking yourself. You don't want to reuse the needle even on the same patient if it has hit the bone, because if it has hit the bone, then the needle tip, instead of keeping a nice bevel, would have developed a harpoon at the end. So as you pull the needle back, it's going to tear the tissue and cause post-operative pain quite a bit. And secondly, if you're given an injection with a bent needle tip, which you will not be able to see if you have hit the bone first, then the second injection is very painful, because the needle is no longer sharp, but actually it's a rounded end, and you have to puncture through this soft tissue, and that'll be hard. Another thing I would like to talk about would be LigmaJect. LigmaJect is an apparatus, it's a syringe, which is normally very pressurized. You're able to give injection into PDL with this, and also some intraosseous injections. The way to do it is you press the lever up on top, and it disengages the plunger in the back. You undo the tip, you unscrew it, and you load up your carpule into it. Once you've loaded up the carpule, you screw the carpule holder back onto the syringe so it maintains it, and then you go ahead and you put your needle on top and you screw it in very nice and tightly. Okay, so once you get the syringe assembled like that and the thing is capped properly, you're supposed to inject by clicking one thing at a time. Every time you click, the needle stays there, the plunger advances into the carpule, but it advances about 2 to 3 millimeters. Now it advances by a lot of force. As it goes in, it also holds itself. So it's self-locking, and the plunger will go in only one way, 3 millimeters every single time. And you notice we are using a gun kind of apparatus, so it does create a lot of force. Instead of using your thumb and your needles to squeeze in the anesthetic, which is good for soft tissue, but if you're injecting into PDL, there'll be a lot of pressure that is needed to get the anesthetic there and to keep it there. This is also great for intrapulpal injections. You bend the needle tip and you go into the tooth and you engage the needle fully into the canal or into the PDL space, and then you click one at a time. Once you're done with this, all the way at the end, you'll stop clicking any further. You see the plunger is going in, and you would have utilized the whole carpio. When you want to undo it, you press the lever up on top, pull back the plunger, and then of course the needle is capped here. You undo the carpule holder and you take it off, and there should be 2 slots on the side, and you can slide the carpule back out, load the next one on, and then you can load the next carpule. And this is how you use a PDL gun. In the case of using a PDL gun, I prefer to use actually small needles, which are normally about a centimeter, centimeter and a half long, so small or extra small, because you do not, what you're doing is trying to get into PDL, and if the needle is long, then the whole syringe might end up moving as you're giving the injection. So that will be an introduction on the syringes, and in the next presentation we will talk about a pediatric injection technique in which we are able to give inferior alveolar block to children without giving the inferior alveolar block. Thank you.